All right, here is what most practitioners miss about temporal headaches. They look like gallbladder. They feel like gallbladder. So everyone treats gallbladder, but in a huge number of cases, it is not gallbladder at all. It is fire channel collapse. Specifically, triple energizer voltage failure disguised as wood. And once you know how to spot it, you will never misdiagnose this pattern again. In this training, I am going to give you a simple 1, 2, 3 diagnostic shortcut. It lets you identify fire collapse instantly, confirm it in seconds, and repair it quickly with TE5 and PC6 so the patient finally stabilizes. It is simple. It is fast. And it will change the way you diagnose exertion-triggered headaches forever. Let's get into it.
Gurpreet says, can you unmute me? Yeah, let me unmute you. I just sent you a request to unmute.
Hello.
Hi, nice
Hello.
to
Hello.
talk to you.
Thank you. Same here.
Where are you?
I'm from India, sir, New Delhi.
Are you there now?
Yeah, I'm there now.
Oh, great.
Okay. I'm a big fan of you, sir. Always I watch your videos and it's quite inspiring.
My
Thank you.
pleasure. Thank you for the
Okay.
feedback.
Okay, thank you, sir. So actually, I'd asked the question previously also, but at that time I couldn't get the answer. And my question is that I myself is suffering from the temporal lobe headache. It is since there for last 2 years, and my job was just a sedentary job. So I am an overeater, you can say it. And the thing is that if I walk even for 50 steps also, I start getting the pain in the front of in the temporal lobe of my this head. And if I stop even for 5 minutes also, the pain goes off. And the pain go if I push myself, and then the pain goes right behind the ears, and it's unbearable. And last time I think you said it is just because of some fire channels. So can you give me some points, some more to treat myself? And I have the POS machine with me, and this is the thing I want
Great.
to know.
Let me go through and give you some possibilities here. Temple lobe or temple area. Temple lobe of the
Yeah.
brain is wood channels.
Uh, it is
So liver and
TE
gallbladder is
triple N.
we're getting to the triple energizer, but first things first, I don't want you to miss that it's possibly gallbladder or liver. Do you have any tooth issues in the liver or gallbladder tooth?
I think I am born with 29 tooths only, so three tooths are missing since birth. So I
Wow.
think the three tooths since birth means 29 only. So the wisdom tooth, only one wisdom tooth is there out of the four.
Gotcha.
Hmm.
So wisdom teeth, as you know, is pericardium, triple energizer, heart, and small intestine.
Yeah.
So what we tend to think that liver and gallbladder feed into each other, but also remember the triple energizer feeds into the gallbladder channel and the pericardium feeds into the liver channel. These are valid linkages as well. So the fire channels could have been drained. Well, you have evidence because the wisdom tooth never came in that some of the fire channels were deficient. Even at birth, it might have been passed down as a magnetic field from your parents.
Okay.
But if there's a deficiency going on long enough in the triple energizer, that will drain off the gallbladder. If there's a deficiency gone on long enough in the pericardium, that will drain off the liver channel. Also,
Okay.
yeah, the other thing is that wisdom tooth tend to, so not so much when they don't come in, unless, have you seen an x-ray where it wasn't there, or is it impacted, or we don't know?
We don't know, sir. I never gone through it
Okay,
because I don't have any dental issue, no dental caries, nothing. So that's why I never
gotcha.
gone to the doctor.
So we'll go through two examples. If the wisdom tooth is still in there, but just never surfaced, that has become a cavitation which drains directly the adrenal glands.
Okay.
And if it's never come in, that's better because there's likely not a cavitation there. And then you're just back to focusing on the fire channels preliminary and then secondary, the wood channels. Okay.
Okay.
Now
Okay.
you said pain behind the ear, and I'm saying, hold on, this is out of view here.
Actually, it is just in front of the Triple Energizer 21, T21, I think.
Okay. There you go. So voltage deficiency on the Triple Energizer channel. Uh-oh. Oh, let me go to a different app here. Okay. Triple Energizer 21 right about here. So deficient Triple Energizer channel. So definitely select Triple Energizer as one of your points.
Okay.
The other thing, it is great for self-treatment if you have TENS pads, sleep with or fall asleep with TENS pads on your non-dominant Triple Energizer 5 and PC6.
Fine.
That's an old trick by Dr. Stripmatter because we want to get you sleeping so your body can rest and recover. You're already deficient in these fire channels, so it'll charge it up, but also it will not only drop you into deep parasympathetic right before you're falling asleep, but it also turns off every single leak temporarily. And you're like, well, it's only temporary. Not you, but people may be thinking it's only temporary. You know, that's what good is that? Well, it's really good because you're temporarily turning off all the leaks. If you're dropping into deep sleep, your body can heal with those leaks gone so that when you stop the machine, yes, some of those leaks will come back, but at a much less degree than they were before you did that.
Fine, so fine.
And
I would
yeah, it's difficult to treat the wisdom tooth on the ear yourself, but you can treat the related body point. I'm trying to pull up my, let's see here, dental.
So I need to put the TENS pad on my non-dominant side that near the Triple Energizer 21 in the right.
No, I would put it on Triple Energizer 5 and PC6.
Okay. Okay. On the
Non-dominant
non-dominant side.
Triple Energizer 5, PC6.
Can I put the POS there?
Yes. Remove the resistors and plug in some TENS pads, or you can remove the resistors, and if you have alligator clips, if you have the regular strong alligator clips, you can use cotton cloth that is wet and connect the alligator clips to the cotton cloth and put that on Triple Energizer 5 PC6, or you can just use TENS pads.
TENS pad. And what should be the frequency and the voltage of that POS machine then?
I like 9 to 10 hertz.
And the voltage?
The voltage, turn it up until you feel it at a light or moderate amount.
Or you can go to up to 50 or something.
Yes, it can go up to 200 safely, but you want to be feeling it. If you go to 200 and you're not feeling it, something's wrong. Maybe there's a wire broken. But this is I generally say all the points, you just want to barely feel it, but this case is a little bit different. You can go to a light or a moderate. You can feel it a little bit more than the other points, and it works really good.
Okay, fine.
The tooth. The tooth that didn't come in, I'd locate it on this chart. So if it was 17, for example, you can treat yin tong on the body because
Yeah,
it's
it is right
difficult
in
to
the
treat on the ear yourself. Let's see here.
yin tang is just
My
in the forehead.
software is glitching. Oh no, here's the upper. That was the lower. So if it's tooth number 1 here, you can treat body point kidney 3. If the tooth's on the right side, you would treat body point kidney 3 on the right side.
Okay, fine. That's great.
There's some ideas for you.
Fine, sir. And
Yeah.
how long the treatment should be? Maybe for 20 minutes or 30 minutes? This
20 minutes is
PC6.
very good, but if you're doing the Triple Energizer 5 PC6 treatment, that can go as long as possible. You could fall asleep with the machine on.
Okay, fine. Otherwise, I can use the regular TENS machine also, which is having some 80 hertz of the frequency. Starts with the
So you'll get better results with the Pointo than the TENS machine.
then the TENS machine.
Yeah.
Okay.
Yeah.
So
And
that's
then this is ongoing. So start doing these treatments and then we'll ask you again, either through email or next time we talk.
yeah, sure, that will be fine, sir. Okay.
Thank you. Nice finally
Thank you.
talking to you, Gurpreet.
Thank you, sir. Thank you. My pleasure. Yes, sir. I'm really great, sir. Thank you, sir. Thank you so much.
My
Thank you.
pleasure.
Thank you, sir.
Okay, so Frederick says, will tooth 1 also fill the kidney channel as well as the 4 fire channels? Great question. Unfortunately, no, kidney 3 will not fill the fire channels, but it will fill the kidney channel. And it will get rid of the leaks associated with this tooth. Kelly says, can you use silver pulsar instead? You can use the silver pulsar. It is higher voltage, above 27 volts. The only problem is when you're treating Triple Energizer 5 PC6, and I think I told you non-optimally, Gurpreet, you want to use 73 to 80 hertz. And I think I said 9 or 10 hertz, which may work, but you're better off using 73 to 80 hertz on Triple Energizer 5 PC6. The silver pulsar is 4 hertz, much slower than both 10 or 73 to 80. And Kelly says for silver pulsar, do TENS pads work as well as cotton sleeves? Yes. If you're doing the blood electric, chop down the TENS pads to guide the electricity into the arteries.
And that is the entire pattern. When temple pain shows up with exertion, wraps toward TE21, and disappears the moment the patient rests, that is not gallbladder. That is fire channel collapse draining wood and presenting as a gallbladder headache. Once you see it, you cannot unsee it, and once you treat the collapse instead of the expression, patients get better fast. If you want this made even easier, download the 123 Diagnostic shortcut. It gives you the pattern, the confirmation steps, and the TE5 PC6 repair protocol so you can implement it right away.